Hello friends, in this video we'll discuss about the virology and it is a part 2. On the part 1 I already posted in my channel. So first we'll continue with yellow fever virus. Okay, so first you want to know what is a vector here. It is an Aedes aegypti. So next there are a few important points you want to remember here is the yellow fever is usually it is absent in India because of the following measures. So one, it is if the unvaccinated travelers came from the endemic zone, they have to be kept quarantined for at least 6 days. Here the 6 days it is an important, and the beauty index it is usually less than 1 for the it is surrounding 400 meters around the airport. And then there is a cross reaction of the dengue antibody, because if the patient have been already affected previously by dengue, so that antibody will be cross reacting with yellow fever and it seems to be a protective factor. Okay, so coming for what is about the immunity, it is about this vaccine is usually it is effective within the after administration, the action starts within 7 days and it will be extending up to 35 years. Okay, so on this vaccine is usually that certificate is issued after the 10 days and it has to be renewed for every 10 years. So 10 you can remember, and here 7 and 35. So coming for the polio virus here, so the most common serotype is associated with epidemic is type 1. Okay, and most antigenic and it is in type 2, and the 2 is associated with VDPV, that is in vaccine derived polio virus. So here you can remember like D is for double, so double 2. Okay, so 3 is usually associated with VAPP. Okay, that is in vaccine associated paralytic poliomyelitis. Sorry, here it is an VAPP. Okay, it's a VAPP. Next it is an. So what is about the polio? Pathogenesis is most commonly transmitted by fecal-oral route, and here the receptor is CD155. Okay, the site of action here it is in anterior horn cells of the spinal cord that leads to the flaccid paralysis, and there is also the hematogenous spread is most common. So just remember these points, it's enough. And so coming for the lab diagnosis, they will be doing a stool culture, that is usually for the acute flaccid paralysis surveillance. So here you want to know, so both the strains are usually on this point I think no need. So just remember 2 is associated with VDPV and 3 is associated with VAPP. So here the polio virus, that is in VDPV, it has categorized as 3 types. One is circulating, immunodeficiency and the ambiguous. So there is an in-game strategic plan, that is mainly to cause an interruption of the polio virus transmission and to strengthen the immunization, that is by pulse polio program camp, and then implementing the containment of the polio virus and the on to the legacy planning, and these have been implicated for the polio virus. So coming for rabies virus, so this is important. The speed of rabies virus is usually about 250 millimeter per day, and there are 2 types of rabies. One, it is in furious rabies, another it is in dump rabies. And this furious rabies, it usually accounts for about 80% of all the cases, whereas a dump it is about 20% only. Okay, so this dump rabies, it is usually associated with the partial vaccine course, because if the patient have been discontinued the vaccine course, then there is a risk of developing this paralytic rabies or the dump rabies. So coming for okay, types of rabies virus. Okay, first we dealt with, it's a rabies. Here rabies virus, there are 2 types. One is a street and there is a fixed. Okay, street it mainly causes a disease, whereas fixed is mainly for the vaccine strain preparation. And street, it produces a negre body. Here it does not produce. It usually affects the salivary gland. Quite opposite here. Doesn't affect the salivary gland. Incubation period for street, it is a 3 month, and for fixed it is in 4 to 5 days. You can remember like fixed it has an F. So 4. 4 also start with F. 5 also start with F. So 4 to 5 days. Okay. So next point is how you can diagnose this direct immunofluorescent test. That is, usually the specimen is taken from the hair follicle present at the nape of the nape. It is a more sensitive. So next is inclusion body. That is it is an intracytoplasmic eosinophilic body called as a negre body. It is usually present in the cerebellum and the hippocampus, and the cellular strain is used for the demonstrations of the negre body. So coming for rabies virus vaccine, it has a non-neural vaccine. So that is purified chick embryo cell vaccine and purified viro cell vaccine and human diploid cell vaccine. Okay, this is what you want to remember. So coming for hepatitis virus, it is an hepatitis virus A. In developing countries, it is the most common, okay, in like children and the adolescent, but it usually remains in subclinical infection. And so developed country, it is mainly because of an improved hygiene, it has been decreased. So friends, in this video I did not post like what type of virus, single standard or double standard. I have a separate video for virology mnemonics, and I will be description below. Just go through that. So here some of the most common cause of viral hepatitis in India. So for acute, sporadic and epidemic caused by hepatitis E virus. The cause of acute hepatitis in children is hepatitis A. Okay, so 15 to 30% of acute hepatitis is because of hepatitis B virus, and chronic hepatitis is usually associated with B, and cirrhosis again it is associated with an hepatitis B virus, and primary liver cell cancer is also by hepatitis B virus, and post transfusion hepatitis is by B. So mainly everything is by hepatitis B virus. So it has a morphological 3 forms, that is in electron microscopy it has 3 forms. One is spherical, it is the most common, and tubular or filamentous, and complete form or the Jane particle. So here coming for the gene, the S gene code for hepatitis S antigen, and C gene it usually codes for 2 nucleocapsid protein, and C region for HPEA antigen, that is an E, and for C region it usually code by HPC antigen, and X it is for HPX antigen, and P gene it code for the enzymes, that is in polymerase so protein. So this is everything you want to by heart. So what about the transmission? So here the parenteral route is the most common cause in the developing countries, and sexual transmission in the developed countries. This both you want to remember, but there are also the vertical transmission, that is during the pregnancy time. So what about this carrier? Simple carrier will be having a low infectivity, that is they will be having a low level of HPS antigen, and then there will be no HPE antigen, whereas super carrier highly infectious, they will be having a higher level of HPS antigen, and they will be having a HPE antigen, DNA polymerase, and the HPV DNA. So simple means they will be having a low, super means they will be having an, so all the antigens will be there which will be elevated. So coming for the markers, okay, so first marker to be elevated is HPS antigen. If it is means it is an indicate an onset of infectivity, and it will be usually remains elevated during the entire duration. They are the whereas HPAG and HPV DNA, they are the markers of active viral replication and high viral infectivity. Okay, so they will be they will be usually elevated only in case of an if the patient is get infectious stage. Okay, if the HPV DNA is low, that is now the values have been, it is less than 2000 international unit. If it is less than 2000 international unit, there is no need for start of the treatment. Okay, here So what about anti-HBs? It is an antibody. If it is present, it means it is an recovery and the patient had gotten immunity, and there is a chain for the transmission, and it is a only marker for the vaccination. Okay, so if the patient have been already vaccinated, when to give booster dose, it is usually needed after the 5 years. Okay, that too if the antibody usually falls below the 10 international unit per ml. So coming for hepatitis C virus, so genotype 1, it is the most common type, whereas in India 1 and 3 are the most common. Okay, so just remember that is enough. So coming for hepatitis C virus, here genotype 1 and 2 are more virulent, okay, and it is exclusively found in the men. G3 and the 4 are also found in the humans, but the most virulent is 1 and the 2, okay. So they are the most common cause for the attenuated and the subclinical infections. So coming for HIV virus, so first it is about the structural genes, that is a gag gene, that is P55, and P18 it codes for the matrix, okay, whereas P24 and 15 it is for the core antigen, and Pol it is mainly for enzyme, that is RT, reverse transcriptase, protease and the integrase. Coming for the envelope gene, it codes for the envelope glycoprotein GP120 and 41. So just remember here, in India subtype C it is the most common, that's enough, okay. So coming for transmission in the world, first it is in sexual, and then parent to child, and then injection, blood abuse and the needle, okay. So first remember, in world most common it is in sexual route, whereas in India it is in heterosexual, then parent to child and then injection drug abuse. So first remember it is in, again here it is in heterosexual only. What about the risk of transmission is by, first here it is in blood transfusion, whereas in the world and the India it is in sexual, but where is a risk, it is mainly because of a blood transfusion. So what is the main receptor here is GP120 of the HIV binds to CD4, whereas in polio I told it is in CD155 and here it is in CD4. And what is about the second co-receptor is this molecule, that is in CXCR4 molecule present on T lymphocytes and CCR5 present on the macrophage line. So you want to remember all these things, that is CD4 and this CXCR4 and CCR5. So what happens here is so if the patient have been mutated with CCR5 and they have become resistant to the HIV infection, okay. So this can also be asked. And coming for what is in PGL, it is in persistent generalized lymphadenopathy. It is more than 1 centimeter lymph node size, that took into or more non-contagious site which have been persistent for about 3 months. What about neoplasia in HIV is Kaposi sarcoma, invasive cervical cancer and the lymphoma, that is in Hodgkin, non-Hodgkin lymphomas. What are the confirmatory tests? That is a P24 antigen and viral culture can be done. So here remember RT-PCR, it is in gold standard, okay. And real-time PCR, it is mainly for estimating the viral load, and HIV DNA, it is mainly for the pediatric HIV. So how you can prognosis, how you can monitor the HIV patient is by the CD4 T count, whether it has been increased or not. But the most consistent is HIV RNA and P24 antigen detection and neoprene. So here gold standard is HIV RNA, that is RT-PCR, and for estimating viral load it is in real-time PCR, and for pediatric it is in DNA. So here what about how to diagnose in the window period? Okay, so it is about 3 weeks to 12 weeks, that is about this will be duration. So at that time P24 antigen usually detects by 1 to 2 weeks, whereas HIV DNA it is the best method, okay. I told you already it is a gold standard method, so you can go for HIV RNA during the window period. So what is that iris syndrome? So what happens is it usually occurs during the recovery phase after starting the antiretroviral therapy. So once you are starting the antiretroviral therapy, the patient will be getting an immune back, right? So there will be an bouncing back of, there will be a reoccurrence of an opportunistic infections in the patients. So HTLV, that is a human T cell lymphotrophic virus, usually causes an adult T cell leukemia or lymphoma, cutaneous T cell lymphoma, and tropical spastic paraparesis, and the autoimmune like inflammatory conditions, uveitis and arthropathies. So coming for the hantavirus, so it is an hemorrhagic fever with renal syndrome is caused by hantavirus, Dobrova and Pumala virus. So this you want to remember. And Seoul virus, this is an hemorrhagic fever with renal syndrome, whereas hantavirus causing pulmonary syndrome is Cinnabar virus. So coming for arenavirus, it has two. Okay, one is a New World, another it is an Old World. New World causes an South American hemorrhagic fever, whereas Old World causes an it causes a Lassa fever. Okay. So coming for Ebola virus. So one, it is I think it's a recent outbreak. Direct close contact with the blood, secretion or any organ or any body fluids or infected animals, humans, whatever the patients they are using, if we are coming in contact with that material, it got usually transmitted. So what about slow virus disease? First, it will be having a long incubation period. It is mainly has a preference towards the CNS, and then will be a strong genetic predisposition. There will be a lack of antigenicity, because of that there will be a lack of immune response. Since there is no immune response, there will be no inflammations will be there, and it does not produce any cytopathological effect. So here the prions have the two types of isoform. One, it is in PRPSC, and it is a PRPC. So this SC, it is a main which causes diseases, and this PRPC it normally present in human chromosome. Okay, so how we will be measuring that PRPSC? It is mainly by the conformation dependent immunoassay or the brain MRI or some other. There will be a neuropathological diagnosis can be done, and there will be a sequencing of PRPNP gene and stress protein, that is in 1433. This is similar number, that is in 1422. It is mainly for the Japanese encephalitis, the vaccine, and there will be an abnormal EEG. Okay, that is a triphasic wave pattern will be there. So how you can causes and decontamination of prions is by first autoclaving at 134 degrees Celsius for 1.5 hours, and treatment with 1 normality of sodium hydroxide for 1 hour, and again here sodium hypochlorite for 2 hours. So again friends, these are all important points only, and I am focusing only the important points. Okay, so you must not leave any single point that I have mentioned here. So coming for rotavirus, so it is a live attenuated serotypes are there. Okay, so one, it is in G1, G2, G3, G4 and G9. So this is regarding the vaccination they will be given, and schedule is by oral route. 2 doses have been given 2 and 4 months after the birth. Okay, and the most serious complication here is an interception. So norovirus, it is the most common cause of the diarrheal illness in the older children and the adult. It usually occurs following the shellfish intake. So there is just it for a remembrance. It's an oyster intake associated with an Vibrio parahemolyticus. Okay, so friends, this completes a virology session. So here, friends, I have completed all the MRB sessions regarding general microbiology and bacteriology, virology, mycology and parasitology, and this completes an MRB revision series. And again I'm saying, please don't leave a single point from this video, and hope I will continue with previous year questions which have been asked in MRB, and also some other important points. Okay, thank you friends.